Well, health reform was signed into law about a year ago. What has really changed? We're going to talk to Professor David Cutler from the Kennedy School of Government at Harvard University. Dr. Cutler, thank you so much for being here today.
It's my pleasure.
Well, you sounded like you were pretty encouraged that things are really on track with reform. Can you outline some of those things that you think are going well?
Yes. We've had a few big things that have happened. The medical loss ratio regulations came out, and I think they came out fairly well. Just last week, we saw the first regulations for the Accountable Care Organization program, and those look like they're coming well. We're starting to see the coverage initiatives in terms of children being able to stay on their parents' policies till later ages. We're seeing a lot of interest in how do providers reconfigure what they do so that they can save money. So the trains are starting to move in the right direction.
And what do you think needs more progress that you had hoped had made more progress by this time?
The single biggest issue on which healthcare reform will live or die is the ability to save money while simultaneously improving the quality of medical care. And that's a multi-year proposition. So we would not have seen the fruits of it yet, but we need to be sure that it's uppermost in our mind even as we have to deal with other things. And so as I evaluate a decade from now, are we going to be happy with this reform or unhappy with it? That's the single biggest issue that I think about. How are we going to save money and improve the quality?
Do you see a growing number of opportunities that will be able to answer some of those questions?
I do. When you talk to various hospital folks, physician folks, when you look at the data, what we're really starting to see is a very big emphasis on, okay, how am I going to become more efficient? What we now need to do is translate that desire to do better into a reality of doing better. And if we can do that, it'll be successful. If we can't, and folks just throw up their hands and say, look, I just can't deal with this, then it'll have turned out not to be successful.
A lot of questions out there. What are some really concrete solutions that people really have to hang their hats on?
The biggest things are, number one is getting the information technology. So there's the $30 billion in the stimulus bill that's supposed to lead to essentially ubiquitous electronic medical records. We've now issued the rules. The HHS has now issued the rules for that. Now we have to make sure that all providers, or almost all providers, adopt those systems. Number two is using those and their internal motivation to say, look, we need to figure out how we do this better. So starting to ask questions like, what are we doing that's not helping patients at all, that's just contributing to cost? What could we do that would increase the experience for our patients while at the same time reducing their use of healthcare? And people are starting to get a sense of that, but really they have to keep asking those questions and keep driving forward with them.
Anything that I didn't ask, David, that you think we should cover?
The issue of the coverage is going to be very important. So we really have to say, okay, we're going to cover 30 million plus people. How are we going to make sure that they get into plans, that they can use healthcare in the right way, that they can get access to the system for preventive care and things, not just for when they're very sick?
Okay. Well, thank you so much for your time today.
My pleasure to be with you.
I'm Mabel Zhang at the World Healthcare Congress in Washington, D.C.